So my name's Cheryl Haswell, and I'm the nurse lead for recruitment and retainment here at GHC, working with the recruitment team.
My name is Helen. I am a research support officer. I work at the Focus Research Centre at Cheltenham General.
So I'm Laura Whitcomb. I'm an occupational therapist and I work as an integrated respiratory practitioner in the Gloucestershire Respiratory Service.
My name's Sam Lonnan. I was the infection prevention and control team lead before I then moved into the role of decontamination lead.
We weren't testing for COVID at the time, but I had all the signs and symptoms of COVID sort of mid to late March 2020. And at the time we were nursing COVID patients in the community hospital where I was a matron.
I caught COVID in May of 2022. I had general symptoms. I think nothing too major, flu-like muscle aches, fatigue. The fatigue was the worst thing. Breathlessness.
I caught COVID right at the beginning of the pandemic. So I couldn't remember the date because it was the date before we went into the first lockdown. So it was Sunday, the 22nd of March. And my friend that I was living with at the time, she still works in the hospital, and she had come home on the Friday before with a cough and a temperature, and I caught it a few days afterwards, unfortunately. Sort of fatigue, very sort of flu-like feeling. I had quite bad tension headaches, a sore throat, nausea, very, very weak, needing to sort of sleep a lot.
It was very early in 2020. It was towards the end of March. So within the first 3 months, I think it was probably about the 23rd of March, I was actually in the control room and I didn't feel particularly well, but I didn't feel unwell. I just didn't feel quite right. And one of the people there said, "Oh, Sam, you don't look very well at all. Are you okay?" And it was as sudden as that, really. One moment I was feeling fine. I think it was probably about 1:30, 2 o'clock in the afternoon. And somebody took my temperature and it was 39.5 or something, which obviously is very high, and said, "Right, you need to go now, this moment." So I quickly left, drove home. Again, I didn't feel particularly unwell. There was no cough, no cold, no signs or symptoms.
But then I had COVID again in 2021 and in 2022, despite being fully vaccinated and taking the earliest opportunities to have those vaccines.
I think after I had COVID, after I'd recovered from COVID, I had maybe a short period where I didn't feel too bad, although I had this fatigue that felt like it wasn't going away. And I think over time, over the next couple of months, the fatigue just got worse and worse. I had a period of a couple of months where I really didn't know what was happening. I didn't understand long COVID. I just knew that I had this overwhelming fatigue that was impacting my life and I didn't quite know how to deal with it. And another new one is shortness of breath. I never had shortness of breath until probably a few months ago. A whole host of symptoms like I think we all have, really.
I've had this experience of a week in sort of thinking that I was starting to get a bit better, and then a couple of days later was completely floored and felt even worse than I did at the beginning of when I was infected. And then I went back to work and just thought, like any other bug, I was starting to get better. So I was walking to work, started to go on some walks outside of work, do some exercise videos. And I think it was sort of after Easter then that I started to feel quite unwell again, and, you know, quite breathless as well, quite wiped out, and really, really just didn't understand what was going on. I used to go into work every day just feeling really, really unwell, really, really run down, really poorly, really achy, and couldn't really understand sort of why that was, you know, continuing. And it got to sort of February 2021 and I was just sort of housebound by this point and really, really struggling, and got sort of signed up with the Bristol Chronic Fatigue Clinic that my GP had referred me to, and they just said, "Look, you just need to go off work now." And I had 2.5 years off that it took me to sort of get to a point where I could return.
But unfortunately, instead of getting better, I became progressively more unwell. And so unwell that I did end up calling 111 and then they sent an ambulance out to me. They treated it very seriously indeed. I hadn't really had anything to eat or drink for probably about 36 hours at that point. I wasn't able to eat. I just had no appetite whatsoever, even though I knew I should do. I just could not bring myself to. And hours and days just sort of slipped by. They hydrated, they gave me a bag of saline, they gave me painkillers because I was in significant pain. They gave me IV paracetamol and then sent me home again. The same thing happened again. They gave me painkillers, they gave me fluids, they gave me an antiemetic because I was being violently sick every time I tried to drink something, and gave me IV paracetamol and sent me home. I felt much, much better for about 5 or 6 hours, but then it was a rapid descent into being terribly unwell again. This time I think I lasted about 18 hours, and this time they did whisk me back in, kept me back in, and that was in Worcestershire Royal, where I was admitted to the COVID ward. And slowly but surely I began to get well. I got back to work for a phased return. It was a 1 day a week, and then it was 2 days a week. And each time I came into work a week later, I thought to myself, what on earth was I thinking coming back to work last week? I was in no fit state whatsoever to be here. And I felt like that for probably 6 or 8 weeks. Each time I'd look back on the week previously and think to myself, I shouldn't have been here, really. I should have been getting well again.
After the first episode of COVID, it took me a while, but I realised that I had this really bad ongoing sinusitis, which continued with horrendous pain and really awful symptoms for up to 2 years after the first event. And I also suffered really bad dizziness, problems with my balance, headaches. I've had no smell now for 4 years. I've got limited taste, which is 4 years. I had some palpitations, I had breathlessness, and I also had particularly awful brain fog.
And I get muscle aches, terrible muscle aches, which are mimicking the fatigue, I guess. I have palpitations now. That's a new symptom. So that started about 6 months ago. So they'll wake me up in the middle of the night and my heart's just beating. And oh gosh, brain fog. I've got the whole brain fog thing. And that's hard work, because I get difficulty when I'm concentrating, and if I concentrate too hard on something, I find that I get this pressure in my head, and it feels like my head's full of concrete.
I've had fatigue, sore throats, headaches, nausea, high temperatures, body aches, muscle pain, sore eyes, gastro issues, insomnia, hair loss, hives, UTIs, chest tightness, coughs, breathlessness, post-exertional malaise, allergy type symptoms, food intolerances. I've had infected lumps and boils, which I didn't think was related to long COVID until I realised other people were getting them as well. Brain fog, anxiety, low mood, body weakness, weight loss and reduced appetite. Now it's changed to weight gain, sort of weird sort of smell sensations as well, and skin rashes. So I've had such a whole array over the past 4 years.
I think initially the biggest issue was the fatigue, the absolutely feeling of overwhelming tiredness. You just couldn't shake off, didn't, no matter how much sleep you had, you never felt any better.
I suppose the biggest, the most debilitating symptom is the fatigue. That is something that I've never experienced before. It's constant, it never goes away. It fluctuates throughout the day, but it never actually goes away.
Yeah, I mean, it's quite variable. I mean, I am very grateful to have recovered to the level that I have now, to go from sort of being, like housebound, bedbound to, now sort of having more of a normal life. I'm grateful for that. And there's some days where I don't feel too bad. But day to day, it can be very difficult because everything just feels like an effort. Even things that should be nice, like meeting up with a friend or doing something fun, it can feel very effortful. I get very fatigued, and that's sort of not just physically but sort of mentally. Sometimes I get to a point where I'm just sort of too tired to even want to speak, and I just feel like I can't take in any more sort of information. And sort of like day to day as well, like if I'm not working, I may just literally need like a day on the sofa where the only thing that I do that day basically is have a shower and get washed and dressed, and then I'm sort of just having to rest.
Even getting up out of bed, washing, trying to get dressed, like I said, even brushing my hair, trying to put my hair up is really difficult. On a day-to-day basis, yeah, doing your normal activities is a huge struggle. It's had a profound effect, I think. But we don't do anything that we used to do. We don't, we used to love going into town, going out for lunch, going out for meals, an ad hoc weekend away, and we can't do ad hoc now. Ad hoc doesn't happen. Everything needs planning.
The self-denial kicks in every now and again. I'm not able to walk as far as I used to. I certainly can't run anymore. I did try the couch potato to 5k, but literally the length of a football pitch, and that was it. I was on my back, breathing. I've got the step tracker on my phone, and that's almost for me really, because sometimes when I do get to the end of the week and I don't feel I can do it, I look back over the previous 5 days and see how much I have done. And invariably there's been a day in there that I've done 15 or 16,000 steps, and I think, well, that's why I'm in the state I'm in now. So it's not necessarily, I keep trying to improve, but you just feel that you can only get so far. I don't know if this will be a recurrent theme, but you feel you can only reach a certain level, and that's the best you can get to before it then begins to recede. And then you push like mad and work like Billy O, and you get to that certain level again. And it almost seems like this ceiling you can't get through. And maybe that's my definition of long COVID. I can only get to being so well.
By going to the GP, there wasn't a long COVID service at that time set up. So I went along and had the investigations the GP put in place, chest x-ray, referral to ENT, to have a nasal scope, all those sorts of things. So I got referred on the right pathways that sort of addressed the major issues, but none of them addressed the fatigue.
So I kept phoning the GP. I was told it was multiple things. I was told I was probably having symptoms of the menopause. I was told I was depressed, all manner of things, and nothing that helped me come to the conclusion that it was long COVID. But I think from that point, from probably July, I was thinking, yeah, this could be what it is.
I had like endless calls with the GPs who, in all fairness, were like, yeah, we just don't know what it is, what to do. And I had to push to be referred to the Bristol ME survey.
I went through the Working Well process where I had a number of interviews with one of their consultants.
Yeah.
I had bloods taken at my GP surgery, and they found out that my folic acid was virtually non-existent. So I was prescribed a high dose of folic acid.
The first time it was formally mentioned to me was at my Working Well appointment in August. That was the end of August, and the lady said yes. She said, you've got chronic fatigue syndrome, stroke ME, which is due to long COVID. And it was like a eureka moment. It wasn't until January when the long COVID clinic confirmed it then again, and then my GP sort of listened a little bit and was like, right, okay, yes.
I actually managed to get an email from them and send it to my GP practice, and then of course once they realised that they would support me, they referred me, and yeah, it was them that gave me that diagnosis. And after the first assessment with them, they'd written out like a proper letter to my doctor that sort of detailed what was going on with me, and I think it helped just to get that little bit of validation and support around that.
So I suppose from a mental health point of view, I didn't have major problems, but I just very fed up in the beginning. It was, was it just being fed up of COVID? Was it being fed up of the symptoms? Felt very emotional particularly in that first year. It was just really difficult. From a resilience point of view, I would say that my resilience was quite low, and it was quite difficult to get that emotional resilience at time when you were going through the long COVID in the beginning. It's got better, but once again, you learn to live with it.
I talk about grief of that person that I used to be. I've lost that person, and I've lost my identity as well. I'm not the person I used to be. You can't see yourself coming out of this. You don't know when this is going to finish or if it's ever going to end. So I guess there's that whole, what is the point of my life now? What am I doing? Where am I going with this? What's around the corner? Do we get to have our life back again? And if not, well, that's pretty rubbish, isn't it? So yeah, the emotional aspect is, again, it's huge.
When I was sort of first realizing that I'd got long COVID, I could feel that my like anxiety was getting worse, and I was getting sort of very low in mood, and the counselling really did me the world of good. You know, it helped me sort of not only address what I was experiencing with long COVID, but also, you know, things that had been underlying anyway. I would say that like my mental health now is, I still get low, I still get tearful, but I have a bit more resilience to deal with things compared to what I used to.
I don't like the new me. I don't want it, and I think there's that denial as well. There's almost that lack of acceptance for me.
I would say the new me I find quite frustrating at times. I was very much like a social butterfly before long COVID, and sort of very active, and I struggle to, you know, now I get obviously tired, my social battery drains a lot quicker, I get a lot more tired, more irritable, and obviously can't do some of the things that I used to enjoy doing. So the new me, you know, it can be very hard sometimes to accept.
The main reaction I think I would get when I'm saying I've got long COVID is, oh, is that still a thing? It's almost that, oh, COVID is gone, so how come long COVID is still about? That's frustrating, because it clearly is. I think once people understand, they can be really supportive, and you know, it's nice to get that reaction then, once people realise exactly what it is you're trying to get across.
It has like a huge impact, and I think it's quite easy for people to think that because I sort of look like myself and sound like myself, they just think that you're okay and just getting on with life normally, whereas, you know, there's still, you know, things that, you know, I can't do. You know, for example, I can't exercise, which I used to really like doing, and, you know, I'm always having to sort of take things like day by day, really. I think sometimes it just does feel frustrating that, you know, it's not acknowledged as much as it could be.
So I suppose the worst possible thing when you've got long COVID is when someone says, oh, you look really well, and you're thinking, oh my goodness, you have no idea that, you know, behind your face it hides a lot.
Lack of understanding comes in, because clearly 90% of the time I think I look fairly well. It's only when really struggling that I start to then look like I'm unwell. So I think that doesn't help either. That's that feeds that thought of, oh, she looks okay, so I'm sure she's all right.
You know, realising that perhaps just because your colleague who has long COVID, just because they perhaps look and seem okay, it doesn't mean they necessarily are managing.
So I have adapted my work-life balance. I took early retirement, and then I started working as a bank nurse for recruitment and retainment. So what I don't do anymore is plan too much and fit too much in, the weekend in particular. What I do is I pace myself. And when I learnt the meaning of the word pace, it meant a lot to actually recognise you are going to get fatigued. And when you are fatigued, you just need to rest.
Obviously, pacing is sort of one, and sort of learning to sort of know your body and what sort of things will set you back. So to try and sort of plan out my week a little bit better, you know, even in my work diary, sort of look, and it's quite easy to tell, think, oh, okay, I've booked in a bit too much here. You know, how can I, you know, can I move this to somewhere else? Can I do this a little bit differently?
I found that the role of in the infection control team, I couldn't keep up. My line manager moved me sideways into a role where I was literally on my own, and that was decontamination lead. Now, there was a certain amount of relief when that role was given to me, but that was tempered by the fact that I used to feel that I did a good job. I did think to myself, oh, I've been put out to pasture, he's getting on a bit now, etc. But very, very quickly, I realised that there was a huge amount of work to do that was just as important as the infection control team. And I was able to utilise my expertise that I've built up over the years in infection control to do that job. Brain fog is a difficult thing to really describe. I'm sure I have suffered with it from time to time, but you almost convince, well, and this is probably one of the issues for me, is that I convince myself that it's simply forgetfulness. When I wake up and I ache all over, I just think it'll be all right, I'll walk it off, I'll be fine. And if you're feeling particularly rotten, or one of those bizarre days where you do suddenly find yourself out of breath, I won't assign it to long COVID, which I do understand is self-denial. I'm determined not to admit to it, even though I know that it's something. So it's a funny position to be in, this interview, discussing long COVID, but at the same time convincing myself that I don't suffer with it. I'll always try to do as well as I can. And this is sort of it just in personal life, but sometimes you just can't. But and something I've learned is perhaps rather than keep pushing and failing at something, I will gauge the level of success I know I can get to. Gone are the days when I'd keep going and it didn't matter. Okay, you might have a line the following day or might feel a little bit achy, but now it's managing what you're doing and what you're expecting yourself to be able to do.
Before I even got COVID, I was very much sort of burning myself out and doing too much. So it has sort of really sort of made me realise that and taught me, it's really important to actually prioritise and look after your own health, which I don't think I'd done before.
But it did get better. They weren't all those symptoms all the time, and I'm just left at the moment with no smell, limited taste and ongoing fatigue issues. So I suppose what I'm saying is there is hope that your symptoms can get better and you can improve with time.
I would say that now a lot of them have eased off, but the ones that I'm still very much affected by is predominantly fatigue. I do get sore throat and headaches, and I do sometimes get a high temperature, nausea, and body aches, post-exertional malaise, and sometimes some variable difficulties with sleeping, and they're sort of my remaining ones, really.
And in many respects, I do feel that I've been very fortunate in the way the trust has looked after me, supported me. Yes, there were some wobbles, and I'm sure that they must have been scratching their heads thinking, what on earth is Sam doing now? But hopefully I've sort of come through. And here we are today.
I went to the long COVID support group that was offered by the Trust, and I found that helpful to talk to people, and it was quite interesting, who had similar symptoms and were feeling the same way. Yeah, I suppose usually I'm not a great person for joining groups. I'm not a group person, but I just find it really helpful to go along and listen to people, even if I said nothing. I joined the Fifth Sense charity group, which is for people with no smell and limited taste, and that was really helpful because I managed to attend a conference there, and to be with people with all the same problems was just quite enlightening, and it just made you feel you're not alone.
I'm now with the long COVID clinic. I've been with them for about a month, and it's almost like, yes, okay, somebody's listening to me. This is really good. This is really, it's nice to just feel validated again, I guess, that this is their understanding and signposting me to different people.
Yeah, obviously the Bristol Fatigue Clinic was brilliant. They really helped sort of get me going again, and I did like a long COVID sort of 6-week course with others there. But yeah, some long COVID support groups. So on the back of the Bristol clinic, there was a long COVID sort of WhatsApp group set up, which has been really good, and also a couple of groups on Facebook as well. And I tend to find that I find the groups most supportive that actually give sort of quite like a mix of, sharing their experiences, giving some sort of advice, and also giving some sort of positive experiences as well. It seems to have like a bit of a healthy balance.
GPs have been good, and I think it's because they've been, you sometimes hear that a patient will go and say, I've got a terrible cold, a terrible headache, you must give me antibiotics, and GPs capitulate, whilst the GPs that I've spoken to have said, no, I don't think that's the best way to go about it. You're just delaying something that's going to come up in future. This is what we're going to do. And I've really appreciated that forthrightness.
To be with people with all the same problems was just quite enlightening, and it just made you feel you're not alone.
I would say the other main element of support that I've received is through support groups, 100% through long COVID support groups like the staff support group, and other ones that I've accessed, because you're getting lived experiences, you're listening to other people, you have those people who totally get what you're saying.
I think for me, it was just people who were supportive of me when I wasn't feeling well. Is there anything I can do to help, or can we change the meetings around, making sure you're not got back-to-back meetings all the time? All those sort of like practical things that make things a little bit easier. So if someone says they have got it, understand how it affects them, because there's so many different symptoms people have and it affects people very differently. And just ask, what does that mean to you? What do I need to do to support you for you to be at work, or for you to be able to come out and socialise, and just try and make those adjustments.
I think for me, it's probably ask. Don't be afraid to ask. I think the big thing is, like I said, the lack of understanding, but I feel that it's sometimes it's difficult to ask about things that you don't really understand. And like I said, I don't think I'm the only one, but I don't think we're very good at telling people how we're feeling and putting that onto people when they don't necessarily, or if they haven't asked. It's you're putting on to other people. So if somebody was to ask and say, so what's this all about? How does this actually affect you? What does it do? Then yeah, I'm more than happy to explain.
Just actually checking in with them and saying, well, how have you been feeling? How have things been going? I think sometimes there can be a tendency for people to not want to mention it, but I think sometimes if it is mentioned, you actually sort of feel a bit more sort of like validated, and like people are aware that you are struggling. And maybe there's any sort of work that they want your input with, maybe to just sort of double check with you as well. Have you got the energy to be able to help me with this? Sort of that like appreciation that things at work can be more difficult than what they were before.
There is always in the back of your mind about brain fog. Have I done what I said I was going to do? And I do get asked quite a lot things that I feel I've already done, and I immediately doubt myself and think, oh, this is going to be one of those bad weeks. I'm sliding back. When's it going to get better? And it's only when I go back and check sent emails or notes that I put into System 1 or whatever it might be that I think, oh no, I did do that. But it's having the confidence to be able to say, yeah, I sent that email. Yeah, I made that I changed the records. Yeah, I've completed that Datex. Yeah, I've updated the risk assessment. When you first hear that, oh, I haven't had that email from you, you think, oh, heavens above, I'm absolutely convinced I sent it. And you immediately think, I haven't sent it. In many respects, I feel that you're also having to perpetually prove yourself. You can't just, you need almost 3 points of reference that you have done that job. So treat people who've got long COVID as you normally would do, but and give them the benefit of the doubt.
You really do need to have a good working relationship with your line manager to explain what you're going through, what help you need, so reasonable adjustment can be made. And it really is important that then that support is given to you, and you need to tell people if it isn't there. So I think that having a good discussion with your line manager, or if you can't, finding somebody else that you can confide in, is quite key.
Ask for help. 100%. You have to ask for help. It's not a sign of weakness. It's 100%. It's a sign of courage, I think, and strength, when you can say, or you can admit, look, I'm not managing too well with this at the minute. It makes a world of difference when you've got the support in place. So don't be afraid to ask. Do ask for help, and find the long COVID support groups. Do it. Seek them out. They're there, and they're full of people who can understand completely what you're going through. So seek them out. 100%.
Yeah, I think it's a difficult one. I think I'm sometimes guilty myself of perhaps not talking about it as much as I should. Be honest with your managers if you're struggling and need any extra support, because in my experience, the trust has been really good with that. And yeah, join some sort of support groups, like on social media that you find are really helpful? A lot of things have been helpful,
Yes.
but I think there is an element of time being a great healer. And I think, especially sort of at the start of my journey, I kept thinking, oh my God, what can I try? Because there's so many things people were trying to get themselves better. But I think there is an element of your body does just need that time as well.